Welcome all. My name is Moni Franks, and I am a member of the Community Artist Series and Events Committee. And we want to welcome you here this evening. And we also specifically want to welcome our panelists who are here to help us talk about and understand some of the mental health services and challenges that we have here in our community. So we're really, really happy to have you here. Certainly, mental health resources is an extremely important topic for all of us to be considering. It's been a tough couple of years that has really had an impact on, our physical, our spiritual, and our emotional beings. And so to be able to speak and learn from our experts on what are some of the services for us to connect to be able to do some healing in some of those areas that may have had some challenges is certainly very, very, very important for us. Before I go into introductions, I do want to do some housekeeping things from you, or with you, and one is, hello, 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 please silence or turn off your cell phones. I would really appreciate that. I think mine is on silent, so we're in good shape. Secondly, the bathrooms, if you need to use them, many of you are from the church, but you go down this hall out to your right, go all the way to the end, turn left, and it's right there on your left. So if you need to use that, that is there for you. I do want to point out to all of you that there's a wonderful schedule of events. For those of you who are not aware, First Presbyterian once or twice a month during kind of the school year months has wonderful concerts and different events that we schedule, and they're all free to the community. They're on Sunday evenings at 4 o'clock. There are two holiday favorites coming up. We're really excited. The first one is on December 11th, and we are welcoming the Shoreline Community Orchestra, and they're going to be doing Sounds of the Season, so that will be really delightful. And then our very own and very famous Geneva Choir, and there are a few of them here, are going to be inviting other musical friends to join us for a holiday concert that we're all really looking forward to. So it'll be some really awesome music and some familiar favorites that I'm sure everyone will want to sing along to. So pick up one of these schedules as you leave, and so you'll have them because there are events throughout the calendar into May, and so you'll be able to mark your calendar with those events. So you will also see that there are baskets as you're coming in and out. We do just ask if you feel that you'd like to contribute a free will offering of any amount. That goes directly to the Community Artists Committee for us to put on other events. And so if you feel so moved, we just want to thank you ahead of time for your generosity in considering that. There's also a reception following this so that you will have an opportunity to talk in person with our panelists and ask them any questions. There will also be some resource material that a couple of them have brought if you care to pick up anything. So I think without any further ado, I'm going to get you connected to our awesome panelists. I have had the opportunity over the last several months to share, I think I'd say, many emails with these gals, and I've really gotten to not only know them and their professions and their expertise, but I'm just thrilled at the heart that they bring for the work that they do and the heart that they're bringing to us today to share their experience, strength, and hope in all areas of our beings and supporting our mental health needs. So first of all, on the very end, I want to introduce Lynn Doyle. And she is the executive director of the Community Mental Health for Ottawa County. She received a master's degree in counseling and psychology from Western Michigan University and a master's from Grand Valley State University in public administration. She doesn't look old enough, but she's been working, she told me, at the county now for 30 years. I think she started when she was about 10, but anyway, she certainly brings a tremendous amount of experience to us from, the kind of the government side of mental health services. And next, we have Jess Hauser-Bryden, and she is a school social worker at Rosie Mound Elementary School. Of course, many of you will know her. She's very closely related to our pastor, and so we're really thrilled that Jess could share her expertise. She earned her master's in social work at University of Michigan, and she's also an ordained minister of Word and Sacrament in the Presbyterian Church. So she comes with just so much richness to her experience. Her work centers on promoting community, positive connection, and feeling safe. She's also committed to connecting and equipping staff, students, and families with very helpful tools so that all that she cares for are feel very supported in their needs, especially in the areas of mental health and success in school. And Sarah Lewankowski has been, on the end here, Sarah, has been a licensed or limited licensed psychologist for the past, here you go again, doesn't look old enough, 25 years. And she is currently the executive director of Mosaic Counseling. And they used to be our partners here right on the corner. And so we miss you, but we're really happy that the school has a little more room for the kids to play. She received her bachelor degree in Masters in Counseling and Psychology from Western Michigan. And she believes that mental health services should not be a luxury and is dedicated to making that a reality, that it is not a luxury, that it is something that folks can access through her work at Mosaic Counseling. So you can see we have some extremely talented women that are going to be sharing with us today, and we're really excited about that. The format is going to be, I'm going to give them 5 minutes each to explain their organization and the services that their organization offers. And after that, the 15 minutes are up, we'll do about 30 minutes of facilitated questions. Our committee has put together a list of questions with our panelists' help related to mental health services, so I'll be asking the questions and they'll have an opportunity to answer. And then we're going to have about 15 minutes at the end, or maybe a little more if we need to, for you to ask questions. And there are pieces of paper that look like this in the rows. If you have a question during the presentation, please write it, put it in the basket. We'll pick those up and then we'll be able to ask those during that last 15-minute period. So, without further ado, I am going to call on Lynn and ask her to explain the services of Ottawa County Community Mental Health.
All right. Thanks for inviting me. Thanks for inviting us. I'm very happy to share some information for you about the services that we do throughout the county. Community Mental Health of Ottawa County is a pretty comprehensive mental health organization. We serve individuals really from birth all the way to death. So we have, under our umbrella, we see folks with mental illness. We see kids with serious emotional disorders. We see individuals with intellectual and developmental disabilities. And we also have services for people who have substance use disorders. Our programs really range from, we have case managers, we've got therapists and counselors, we have psychiatrists, nurses, OT, PT, speech. We have peer support specialists. Those are people who have lived experience who work with some of the individuals we serve. We are countywide, so if you live in Ottawa County and you qualify for our services, we'll be able to see you. And our services are primarily for individuals who qualify for Medicaid, and also individuals who are underinsured or have no insurance. Our funding for our services comes through mostly Medicaid. We're about 90% funded through Medicaid. We also have some state general fund that we can serve folks who don't have Medicaid, and we've also got grants, and we also have the CMH millage, the mental health millage that was passed in 2016. So that allows us to do some more creative programming for people who might not otherwise fit into our services.
much, Lynn. I appreciate that. Jess, would you like to explain your role within the Grand Haven Public Schools?
Sure. My name is Jessica Hauser-Bryden. The students at my school know me as Mrs. HB. So if you ever see some students here at church or in the community and they're going, Mrs. HB, that's me. So I'm one of many social workers that are a part of the Grand Haven area public schools. We have social workers that support our early childhood special education all the way through high school. So at every level, there's our social workers. Just want to explain a little bit what the social work role is in Grand Haven Public Schools. It's different than maybe some of you remember the counselor role in the public schools, or it's different from counselor or therapist, social worker. We're a part of a student support team. And so in the schools, we have multi-levels of support. It's called multi-tier system of support. So there's 3 different tiers of support that we provide students, and I'm involved in all those areas. So for the most broadest, the tier 1, a social worker might be involved in the building's climate and culture, supporting students in knowing what the expectations are of school, supporting teachers and how they connect with students and teach those expectations, and how we can celebrate our successes together. The tier 2 is working with smaller groups of students that might have lagging skills in social emotional areas, and maybe providing smaller groups for that, or again, equipping teachers to address particular needs in the classroom. And tier 3 would be for those students who need the most intensive support. Thankfully, in Grand Haven schools, the social workers are able to work with special education students and general education students. That's not true for all school districts, depending on the funding, but in my role, I'm able to meet with students who might not have what we call IEPs, which is their individual education plans. I can meet with students, and I do meet with students who are I don't say just, but they don't have that specialized education in that setting. Just some other ways that social workers support students, support staff, support families, is that we often, we were speaking earlier that I work with students, but I do a lot of work with adults, providing referrals for parents who might want to access mental health services outside of the school setting. We do risk assessments and crisis response with students. Basically, a lot of what my role and my colleagues' roles are to remove barriers for students, for teachers, for parents, remove those barriers to success in the school setting. So a way that I differentiate to parents or adults that might have questions for me, the work that I do is to help students be able to be successful in the classroom. And so that's why a part of my work is doing referrals. If it's something that maybe is affecting them at home or affecting them in all settings, that's when I would be providing referrals to students and their families. So that's just I'll talk more, but that's just a little snapshot of what school social workers do.
Thanks, Jessica. Sarah, can you tell us about Mosaic Counseling?
Hi there. Yes, I would love to. So my name's Sarah Lewakowski, and yes, I used to be next door for many, many, many years. This is my 18th year as director at Mosaic Counseling. We were founded in 1978 by 6 local churches, including First Presbyterian Church. And so for most of those years, we were right next door, and we served the people of the Tri-Cities. But we discovered that we really wanted to be able to help more people. And so we were Tri-Cities Ministries, we're now Mosaic. We're county-wide now. And so if someone lives or works or worships or goes to school in Ottawa County, our pledge is that we're not going to turn you away. And so probably it makes sense, that commitment has become harder and harder and harder over these last several years. But we have been able to keep up with that. Our model is unique, and so we are able to add therapists. In the last year, we were able to add 45 new therapists to our panel, and we have 165 now, because we want to remove every barrier, and one of those, too, is just accessibility as far as time goes. So, if you call a therapist, an agency, and you're told there's going to be a wait list or it's out months, that's a barrier. So we provide outpatient counseling to people who fall in the mild to moderate. And in addition to that, we also have a school outreach program. So it would really complement what Jess was talking about. We are not in her school, but in several schools in Grand Haven and in Spring Lake and West Michigan Academy. Now we're in 28 schools all throughout the county, and that's to remove the barrier of finances and transportation. So if we were in Jess's school, and these are the students that she would be referring to us that then just don't make it because of transportation or the family culture. We also have an employee assistance program, and that we're the EAP for North Ottawa Hospital, for Shape Corporation, for many nonprofits. And my favorite are school districts. You think about all the teachers and the staff there who might want to access mental health services, and they can do that through Mosaic. And we also provide suicide prevention training. So Mosaic has trained over 9,000 people in the county, half of those teenagers right at their school, in suicide prevention. It's imperative. And I would say to you, if you've never been trained in QPR, question, persuade, refer. It only takes an hour, and it empowers you to know what to look for and then what to do. And we advocate for mental health. We do, as Maya said before, we just believe that everyone should have access. And so because of that, we are expanding now to Kent County. And there's a reason for that. We received some funding there. And then we would like to expand to Muskegon County because the model is unique, and we just want everyone to have access. So thank you.
Wow, you can see why we recruited these panelists, can't you? What a wide range of experience that we're going to be able to talk through with our questions. So we're going to take a half hour now. I'm just kind of taking a quick view of the time, and we'll go through some questions. While we're going through the questions, I just want to remind you, if you have a specific question, please write it down, and we'll go through those in the last 15 minutes. So the format is I'm going to ask a question, and then each of the panelists that would like to answer the question will kind of give me a sign that they would like to have an opportunity to answer that question. Not everybody may answer every single question. So panelists, in your experience, what are the 3 most common mental health issues or conditions that we are experiencing today? I would say, I said locally, but kind of, maybe let's say Ottawa County, since that's really a focus of our group. So, good. Sarah.
I think we probably all went like
Thanks,
this.
yep.
I would say the top 2 for us are anxiety and then depression. And I was thinking about number 3. Number 3 is just many different things. I was just looking at, we would say for us, it's the presenting issues. What are people saying when they call? And it's truly relationship, marriage, grief, might be eating disorder, might be stress, might be feeling suicidal. So for us, that number 3 just covers so many. It's such a variety of different things.
I would agree with that. Depression, anxiety, and substance use disorders are also something that we see very frequently. Some data to back up that comes from the Community Health Needs Assessment that's done throughout our county. The last one was done in 2020. That assessment's done every 3 years, so the next one's going to be coming up. But 21.8% of people have been told that they have a depressive disorder. For anxiety, that's 22.9%. 19.8% of adults in Ottawa County are considered to have a mild to severe psychological distress. So it's pretty prevalent.
I agree with everything that's already been said in the school setting. Something that we're seeing in all the buildings is really both students and adults, but a trauma response to what we've experienced, locally, nationally, globally with the pandemic. And a lot of that trauma response can look like ADHD, and so it's difficult for providers, staff to really know what's presenting, or is it comorbid, but just seeing a large rise in student referrals, which stems from just the uncertainty and just really the traumatic events that many people experienced over the past few years.
Well, I think that's a good segue to the next, and I know we can't always pinpoint specific causes, but certainly the pandemic has had an impact. Are there any other kind of common causes for mental health issues or distress that you find with the clients and the students that you work with? Go ahead, Lynn.
Well, you're right. There's not always something that you can point to as being the reason why someone might be anxious or depressed. But, you've also mentioned COVID. There is a lot of stress in the world right now. I think we probably have all, we can all appreciate that, but I know from a mental health service provider perspective, people are just really stressed out. The pandemic had a lot to do with that uncertainty, that fear. There was also a lot of loneliness, especially in seniors who couldn't maybe get out of their house. But in general, it's not just the pandemic, it's the world in which we live in right now, right, can be pretty stressful. The news is stressful often. Politics can be stressful. I think these guys would probably agree with me. Social media has put in a completely different spin on what students and young folks have to deal with on a daily basis, because it's just really in their face and it's real immediate. So those are things that we can impact those too. We can help people learn how to live with stress and teach them techniques to lower that stress. So that's good.
Yeah, I would like to say, in addition to stress is a huge thing, but to trauma, also trauma and then secondary trauma. And that's really been really exacerbated by COVID in the last couple of years, or the number of people suffering from the secondary trauma of first responders, of people working in hospitals, of people working in education. And I know I've been asked on several occasions to speak to compassion fatigue. And when you're feeling like you just, you're taking in everything, all the trauma around you, it fills up your bucket, and things can just start spilling over in your own life, and it's not necessarily things that have directly, happened to you.
In the school setting, when teachers or parents will come to me and wonder where kind of some of these mental health warning signs or behavioral signs, what's at the root of them, a lot of times it's lack of students' lack of basic needs being met. So food insecurity, or a huge one, which my own spouse and I have had our journey with, is adequate sleep for children. It's amazing how many problems can be solved if a child just gets regular, sufficient sleep. Also, again, the the exposure to trauma exposure when they were at home, and not knowing, they were there with their parents, but their parents were working, whether it's online or they had to go somewhere to work if they were first responders. And again, what Lynn was saying, just the access to social media, just just it's ever present for these young ones, and it's the waters that they live and breathe in. And so a lot of some of those behavioral things we're seeing, if we unpack that and just see what they're experiencing or not experiencing in their daily lives.
So if we have a loved one that is experiencing, depression, anxiety, stress, difficulty sleeping, all of those kinds of symptoms that you're describing, what would really be the first step from your organization standpoint or your school standpoint on how somebody would seek help to start to deal with some of those issues that they're being confronted with? Sarah.
So I would suggest to them that you can help them get connected to Mosaic Counseling. It is just such an easy referral because you don't need to know if they have insurance, if they have a high deductible, anything like that. It doesn't matter. And so suggesting that they call, and that can be really scary. So you can always say, hey, I'll sit with you, I'll call, I'll be right with you when you call. I can call for you, I can go there with you. Just to know that we first do an intake because we want to match that person up with the therapist that's right for them. We have the most amazing person who answers the phone. She is so sweet. But then, if all else fails, you can always say, hey, I met this nice lady named Sarah. You can ask for her. And I'll take that call and I'll talk to someone because the sooner the better. Always the sooner someone can get in when they need to talk to someone, the better. And then you can be the sister, the friend, the mother, what you need to be, and that's an important relationship.
I just have a quick follow-up to your answer there. Is this for all ages? Would a child that's seeking mental health support services, would that be an appropriate call, or would that be something that would be worked through your school programs?
That would be all ages.
All ages.
All
okay.
ages. The counseling that we do in the schools is always from the schools. We have contacts in the school. They do those referrals. But if we thought someone that was the only way they were going to get in, we can talk to the school and hopefully that could happen. But all ages.
All ages. Good. Jess, would you like to answer?
Yeah. In my setting, if a family identifies they want ongoing therapy or ongoing connection to a mental health provider, then Mosaic is a place that is one of my first stops to refer folks to, because for like what Sarah just said, that the intake person can really identify what are the needs that the family's talking about. If it's for further evaluation, I often will recommend that families contact their pediatrician and then kind of just see if there's biological or physiological things happening. And one program that a lot of our pediatricians in this area have access to is called the MC3 program, which partners with University of Michigan psychiatrists for a consultation. So it's a way, knowing that here on the Lakeshore, some of our the depth of access to psychiatrists, there can be wait lists for that is a need that's been addressed by University of Michigan to help families who are seeking that level of support. Their pediatricians, it's something that the pediatricians can access as a support, so they can kind of get a better sense while families might have a longer wait for psychiatric support.
Well, I would say that all of that information is incredibly important. There's also call 211. So if most people are familiar with that, they actually do have quite a few resources listed, and they can walk you through maybe what you're looking for. They're not therapists, obviously, but they do have a lot of information that they can give you to try to get you to the right place. There are some national phone numbers, call lines. There's a brand new 988, so you just have to punch in those three numbers, which is a national crisis line with a live person that will answer. And that system can also get you back to some local resources. So it's not just someone sitting in a different state. You can also call CMH. We will listen to whatever your questions are and try to get you to the right spot. We might refer you to one of our local agencies if you don't meet criteria for our services, but that's also a resource, a place where you can call if you've got questions. There is a lot of good websites out there right now for people who just want to explore and get more information about mental health. Mentalhealth.gov is one of those. The SAMHSA, which is Substance Abuse and Mental Health Services Administration, their website also has just some real basic information about mental health and what different disorders look like, what some of the symptoms are. It's not a place where I suggest you go and diagnose yourself, but a lot of people just want, background information so they have more, answers to their questions.
So why is it so hard to navigate mental health services right now? I mean, the need obviously is great. We've all kind of felt that stress, but what are some of the barriers, or why is it so difficult to get, linked into correct mental health services? Anyone like to start? Okay, I guess we're having everybody answer and that's a great thing. Go ahead, Sarah.
Well, I think that, for one thing, there has been some stigma reduction. So there are more people reaching out. The younger generation, they will tell you who their therapist is. It's no problem at all. That's different. When I started in private practice 25 years ago, if you saw a teenager, they seemed like they were brought in it was a punishment. And it was really hard on the therapist to build that rapport. So that's one thing. And there are so many people right now in need of mental health services. And it is hard to navigate. It's very hard, and that's why we have been wanting to expand so much. And as I reach out myself in communities outside of Ottawa County and call places, because I need to know what are the services in the area, I can't believe it. I can't believe how hard it is for me, and I'm just pretending to be a client at that time, but so hard to find services. And especially if you are uninsured or if you are underinsured, a high deductible, or the wait time. I called a place recently, and it was going to be $226. I said, I can't afford that. They said, well, I don't know, maybe you can talk to someone in billing. And I said, okay, well, how about I'll find someone to help me. How long is the wait going to be? At least 6 months. Well, there are people that don't have 6 months. So it is hard. And I think there's a lot of different reasons just why that is. And there are therapists, there aren't, enough therapists. They're busy too. Very, very busy right now.
One thing that came to my mind is a barrier that I've talked to parents about and to staff about, and that we have a lot of students in our community that are might have suicide ideation or struggling with some very serious depression. And thankfully, we have staff in each of our buildings that's trained to identify that and to respond in that crisis moment. But then it's, what do you do after that? For teenagers, and especially for young adults, those who have turned 18, and beyond, because they're adults and you are still their parents and you still love them, but that changes the dynamic for that. And the pandemic disrupted all areas of life, and one area of that is just what do you do when someone, especially a young adult, is having ongoing struggles with suicidality. And I've recently learned of a program that is growing, but it's called Be Better. Wait, I don't want to say that wrong. But yes, Be Better Holland, which is starting to address that need. So for teens, for young adults, and for parents, they're addressing that need in the community. But again, I've journeyed with parents who said, I sought help for my child, and we went to the ER, and we weren't able to get a bed or get access to a program. So it is the need out. There is a lot of barriers in that way.
Would you like to answer?
Yeah, I would agree with what everyone has said. It can be difficult to get services. And there is, unfortunately, some red tape. It depends on what your insurance is. Thank goodness, there are services that, like Mosaic, that they're able to see just about anybody. And there are a couple of local agencies in Ottawa County that will see folks who don't have insurance. But the need really is greater right now than I've ever seen it. I've been involved in the system for 30 years. And for CMH, and I think for most organizations in the mental health field, the request for services is higher than it's ever been. And that's a good thing. It's in that people are seeking help. That's great. I think it really is helping with that stigma. But there is a true shortage of staff as well. Everyone knows about staffing shortages throughout. It doesn't matter what position you're talking about, but in mental health, truly, it is very difficult to find master's level clinicians. We've had positions open for a year for some of our teams that are hard to fill on any given day, but they're especially hard to fill, like our crisis team, our ACT team, which is assertive community treatment. So it's those are some of the barriers. It's not it's sort of gotten worse in some ways as far as it's the perfect storm. More people want help, and there truly is a shortage of staff to take care of everybody.
Just a quick follow-up. Has being able to do telephonic and or kind of Zoom counseling, has that helped at all with some of the access issues that you are facing? I would say especially the two of you.
Yes.
Okay.
Yes, it has.
I would suggest that, I would suspect that it would,
Yeah, the only issue is there are some people who just don't want that. That's a part of our intake now. Are you willing to do teletherapy? Certainly for children, it's not what we would want to use. So with children, we want to still be in person.
Okay, good. I'm wondering if you can kind of give me some thoughts about how politics, and we're not looking at any specific party here, but just how politics and mental health services intersect from your perspective within your organizations. Lynn, you're probably the expert on this one.
Well, most of our services are funded by Medicaid. The budget for those services is set at the legislation, so we're definitely impacted by politics, and certainly the money that flows down to us. So. And there's also occasionally things we do that might be politically people might have a difference of opinion of the right way to handle those services. Substance use disorder services sometimes can be controversial when you're talking about harm reduction services. But in general, I mean, we try to be very non-political. We serve as many people as we possibly can, but definitely from a funding perspective, there's a tie there.
Yes, locally, directly, that a way that politics is involved in the work that I do is that in 2018, our county passed a millage that the school district, Grand Haven School District, decided to use a portion of that to increase their mental health supports. And so we went, prior to that time, prior to my hiring in 2019, social workers would go sometimes 3-4 different buildings. So it really was more limited to crisis response and working with students with special education programs. But because this community was an informed community and involved politically and voted to pass this millage, it made it possible to have at least one social worker in every single one of our buildings, and in the secondary level, more than one. So it really, I've seen a direct impact in having a supportive community that's engaged politically and is supporting what we do in schools.
Very positive. Sarah?
We have seen where it can affect people's relationships with other people. Someone might have a people that are their support, their social support, and now they're not speaking because of politics. So we've seen that and just show up as causing a lot of stress with people because of those relationships with friends or family or coworkers.
We were talking prior to getting started about just how many relationships we have seen that have been really impacted by certain political views. So these strong political views, unfortunately, are somewhat becoming a barrier in some relationships. So interesting to get, funding, very much controlled in the area of politics. Just the, real positive that our community embraced needing more mental health services in the schools, and then really how politics is impacting individuals. So it's just interesting how that kind of weaves in and out. We're going to just do one last question. I don't know if anyone has written down any questions. So if I could have Troy, would you mind just picking up the baskets and maybe bringing those forward to me, if you wouldn't mind? We hadn't planned that, or thank you. So what are ways that each individual or each family, or as a grandma, as grandparents, supporting grandchildren, what are ways and techniques that we can use to improve our mental health or the mental health of our loved ones?
So I'm going to say as much direct contact, putting phones down, playing board games, sleep, so important. I mean, these are going to be really simple things, but they make such an impact. Sleep and exercise, eating healthy, all of those things affect our mental health. Things that that you can do. I mean, self-care. Self-care is huge, and it doesn't mean to be selfish. It's taking care of yourself, doing things, having boundaries. Letting people know that you need some time by yourself, and then maybe journaling, mindfulness, meditation, prayer, spending time with friends. All of those things, those are things that you can control and that are so important when you have the control to do those yourself.
Great.
So when taking I 100% agree with everything you say, and I don't know, trying to think of what to add to it. I think when I speak with parents and they want to know how can children be social emotionally ready for school. They say it a little bit differently than that, but how can they be successful at school and be well at school. And it's a lot of those same things, making sure that you have routines at home, you're eating meals together. We have busy lives, and I know that's not possible, but even having I've heard of some families, they said forced Friday fun time, making rituals around that. Again, adequate sleep, having play experiences, experiences that aren't, sports are awesome, they're so important, musical groups, planned activities, but having those unplanned, less structured play experiences that children can be exposed to, and then healthy boundaries on social media. I would steer away from just taking it all away, because your children, students, grandchildren are going to get access to it somehow, but having open and honest conversations on, what are our house rules and how can we support each other, and having healthy boundaries with that.
Good. Do you have anything to add?
The only thing I would add is don't be afraid to reach out and talk to your families and ask them how they're doing, and just check in. And all of the stuff that was talked about just previous are amazing things that you can help your loved ones to do to remain healthy overall, but certainly mentally healthy as well.
So we're going to shift over, and thank you for your questions. I'm reading through these, and they're awesome. So I really appreciate the thoughtfulness that you've put into writing the questions. And I thought that this was an interesting one kind of to start with, especially considering we are a church. And the question is, how have churches possibly hurt community mental health services? Have any opinions on that? And maybe not.
Oops. I would say the opposite, actually.
Okay.
That churches frequently provide that feeling of belonging, that companionship. It helps with loneliness. Certainly, if anybody takes anything to extreme in a church or their religion, that might not be the best thing, but we at Community Mental Health, we actively try to help our folks get connected to a local church if that's what they want to do too, because it really, it adds just so much value to their community.
Good, good. Anything else to add at all?
I was just going to say what Lynn just said during an intake. If we're doing one with someone who is all alone, maybe they moved to the area recently, or maybe they've lived here for a long time and just don't have anyone in their lives, then we talk about if they're interested in a church that they could go. And I might even reach out to the pastor and say, with their permission, someone is going to come up and talk to you after church. And, hopefully that can be a community and a support for them.
So the follow-up question on this same sheet of paper was really, how can churches help with mental health services? And it sounds to me like you're saying, being that open community where you're welcoming folks that are hurting and being able to provide that friendship and support. Is that kind of a good wrap-up?
And it can then with that comment, it can also help if a church says that it's okay to go get help, that it's okay to reach out for help. That's so helpful, that someone doesn't feel shame.
Yeah. Jessica?
Yes, I can't speak for all the various denominations and expressions of faith in our community and beyond, but I do know there's a raised awareness of clergy and spiritual leaders that, they have their knowledge and their strength in certain areas, and many clergy will refer out. So they might meet with an individual or a couple or a family and say, I'm here to pray with you, support you, but what you're facing right now, we need to widen our circle of support. And I would just say to folks who may have had negative experiences, if you're sensing that you've met with a faith leader and it's not helpful, or if it's not answering your questions, then I encourage you to, to give Mosaic a call, to give Community Mental Health a call, and to not just stop with that, to not have that be a barrier for you to seeking help.
Good. A question here from one of our audience members is there a support role, like a tutor, a friend, kind of quote unquote, or a coach that someone could be trained on to volunteer and be a support within your organizations at all? Go ahead.
So I don't know if everyone's familiar with the Momentum Center locally here. The Momentum Center is one of the social recreational programs that CMH funds with millage. They've got other funding as well, but we provide some funding for them, and they've got volunteer opportunities all over. It can be just sitting down and having coffee with someone. It can go, it can be going, they do a lot of community activities. They go to Whitecaps games, and having people go with them is very important, just to, again, build that community and build friendships. So that would be an excellent place if people wanted to get involved.
Good. I was able to stop at the Momentum Center and drop off flyers, and boy, it was just such a great spot. There were so many folks having coffee. I ended up sitting down and staying for quite a while and chit-chatting, and it was really, so I would agree with you. It seemed to me that there's some really awesome opportunities through that center, which is centralized right here in Grand Haven. So I thought this was an interesting question. With the massive need for mental health services, mental health providers themselves must be overwhelmed. What are the resources available to help mental health service providers kind of take care of themselves? And is there a way our community can even further support mental health providers? Anyone have any thoughts on that? Yes,
I can
Jess.
share two things that Grand Haven Schools is providing their staff. We take advantage of the EAP program in partnership with Mosaic. They provide 2 sessions for all staff or family members. So it can be 2 sessions for, let's say, for myself, or 2 sessions for one of my children. And then also the district has been providing coaching support for staff free of charge, that a person outside of the school district to someone that can be an encouragement. That it's not mental health care, but it's someone that encourages you in your work, especially if you're feeling burnout or stuck. So those are 2 tangible ways that Grand Haven Schools are supporting their staff.
Great. Any other thoughts at all?
Well, we are obviously all about our therapists.
With that many, I think so.
Right, and think about things that we can do for them throughout the year. We are in talks with a local church and actually putting together a service just for them, which I'm really, really excited about.
Yeah.
We don't have a date yet, but we're working on that.
Nice way to honor them, that's for sure. So, good. This is a specific question for you, Lynn, on CMH. Is there an assessment process that you need to go through to become a recipient of CMH services?
Yep, there is. So the way you get involved in community mental health services is to give us a call. You can stop in at one of our offices. We have an office at Fulton Street. We have an office in Holland and in Hudsonville. We have staff out there occasionally. But you'll talk with someone on the phone, typically, is how it starts. And they'll ask you some questions about, how you're feeling, what's going on in your life, and kind of navigate you to the right place. If it's us, we'll schedule you for an intake appointment with our Access Center. If through those questions that we go through an intake phone call, it looks like you're actually more appropriate for going a referral back to your insurance company, your insurance provider, or one of our local providers because your issues might be more mild to moderate. We typically take care of people who have severe issues, but we'll get you in for an intake appointment after that phone call. The standard, according to our contract, is 2 weeks. We do everything we can possibly do to get you in as quickly as possible. Like Sarah said, it really is about trying to help people as quickly as we can, because they might not be so motivated next week or the week after that. So if they had the courage to call, we definitely try to see people as quickly as we can.
Okay, good. Sarah, this question is specifically for Mosaic. Does Mosaic Counseling see seniors for depression, and does it cost anything? And then how many times a month would you be able to come for counseling services?
So thanks for asking that. It is all very individualized. We see any age. So I think our youngest client might be 3 and 103 or beyond. So yeah, any age. We don't turn anyone away. So we figure it out. And so that would be very individualized. If someone has insurance, if they don't, we figure it out, but we're not turning anyone away. So it's going to be something you can afford. And then it would be dependent on you and your therapist. How often, do you need to come in? And it could be weekly, it could be bi-weekly. So that's all determined on a need-to-need basis.
Good. And then Jessica, there is one last question here for you. Are you experiencing or seeing the students that are struggling with sexual identity issues, either K through 5 or teenagers? Is that something that you're seeing as a mental health concern in the schools?
So it's something that it's a conversation that students are having. I think, Sarah, you were earlier you're talking about the reduce of stigma, and that the younger generation is willing to say, here's my therapist, this is how I'm seeking help. Students have a larger range of comfort having discussions about their sexuality or their questions they might have. And I think the importance of adults, whether it's staff or parents, caregivers, is that they are able to have caring and honest conversations with students and developmentally appropriate conversations with students, but to not be able to speak with students that they're having those conversations and they're seeking out information in ways that may or may not be helpful or even accurate for them. So it's important for adults to be educated about issues of sexuality and questions that children and students might have, and be equipped to, and if you don't feel equipped, then to reach out and educate yourself and find trusted people to have those conversations with, because it's important to be able to support students that have these questions, so they're not getting that information maybe from a peer that has misinformation, or seeking it out on the internet in ways that may not be safe for them. So that is definitely something that students of starting in, I would say, upper elementary through secondary schools, that they're talking about this, and they want to know. They want to know accurate and be able to ask questions in safe ways with their peers, and hopefully with caring adults too.
So in closing,
Could I say one thing?
Yes,
just
Sarah,
add
yes,
on
go
about
right
the
ahead.
kids. I wanted to fit this in somewhere.
Sure.
So there's a youth assessment survey done, just like the community needs assessment. And the last youth assessment survey, it came out this year, but it was from 2021. So these are high school kids. I think it's 8th grade, isn't it, Lynn? Starting with 8th. 31% of our teenagers said they felt depressed. 31%. 20% said that they have thought seriously about suicide. 13% said that they have thought about a way that they would commit suicide, and 8% have attempted suicide. And if they're from the LGBTQ community, that thinking about it is 4 times greater. So our kids, you know, this is important things to know about how much assistance they do need and how they're feeling right now.
Well, you had mentioned the suicide prevention training through your organization. If somebody was interested in taking that training, just give a call to Mosaic. Okay, I think that would be certainly something that would be very valuable, especially with those statistics. So, in closing, if there's anything we've missed that you would like to say, I'd like to give you the opportunity to do that. Is there anything that anyone else would like to say? Feeling pretty good? Well, it's certainly my pleasure that all of you were here. This is great, and the questions were just really awesome. We really want to thank our panelists. Let's give them a big round of applause. Thank you. And we will be meeting in the parlor area for a reception, and I saw some pretty good goodies in there, so please join us, and you'll have an opportunity to interface with the panelists in there as well. So thank you so much for coming.